How are you? Great, thank you. Great. Oh, I'm tired.
You want to get going? Shall we ask questions here?
Just go ahead.
You're here, we're here. All
Okay.
right, listen, I'd love some clarification because yesterday Premier Doug Ford said that the Prime Minister didn't give any direction that the money has to go towards the public system and not private delivery in any way. But today, we hear from Prime Minister Trudeau that he wants the premiers to support the public system. So what did happen yesterday? Are there any strings attached to this money in this deal that would require premiers and the provincial health systems to focus on the public delivery of health services?
Yeah, I think what everyone left there with, and when we keep saying we need to, digest what was all presented yesterday and how it will impact each jurisdiction. I think part of that will be, what we'll do in P.E.I. The Prime Minister did outline at the beginning that he wanted to make sure we adhere to the public health in general, and a lot took place in there yesterday in terms of overall discussion and things like that. But from PEI's perspective, we're looking for. I didn't get the full transcript of what he said, but he gave an opening statement. Minister Freeland spoke, Minister Duclos spoke. We asked questions along the way, so a lot took place there. But in terms from a PEI perspective, we have a healthcare system that we're trying hard to improve, and that's going to be our focus. That's what we'll use the money for.
Do you think that the federal government really, lowballed you? If we're looking at the 10 years that the premiers are asking for, the Fed's offer is $233 billion short over a decade, so it seems like it's far less than what premiers are asking.
Yeah, I suppose for as long as there's been premiers and as long as there's been prime ministers, there's never been enough money going to the premiers overall. I look at it just from the overall perspective that if PEI, it will mean over $400 million in new money over 10 years, 75% of that which is in the bilateral process, which means we get a little bit better than we would in the straight per capita. So overall, that's money we need to spend. Will we need more along the way? Yes. Will we stop trying to lobby the federal government to help with into a greater regard when it comes to spending in health? Yes, but to me, that's a significant amount of money. It's money that we need, and I'm ready to put it to use.
So you will send a bilateral agreement? Have you made that decision?
Look, we will, from what I understand, Minister Duclos will be reaching out to the Minister of Health, Minister Hudson in our province. I've talked to Minister Hudson this morning, and I said I look forward to you chatting with your federal counterpart and let them know that our priorities are the shared priorities of the federal government, and look, we're ready to go. We'll have a budget coming out here for the next fiscal year. We want that money to be in our budget. We want to put it to use and to make healthcare a little bit better for Islanders.
And do you know what day you're meeting with the other premiers?
I think we're having a call on Friday, I believe, is when we're having a virtual call just to sort of as a follow-up. We were going to do it on Monday. I think people thought it would be better to do it a little bit earlier on Friday, so I think it's scheduled for sometime on Friday.
Do you see a possibility where maybe some provinces will want to sign bilateral agreements, or are you guys all going to come into this on a united front?
I think if you look at what happened, it's a similar process to what happened with childcare, essentially, is that we were a little bit more eager to do a childcare agreement than maybe Quebec was because they had a fairly significant system, for example. But I think throughout it all, each province did their own little bilat with the federal government and made that childcare deal work. I suspect it will work the same here from a small jurisdiction to say we need to have that money to put it to use to innovate our system and to improve healthcare. So it'd be my interest to get that going sooner rather than later.
And for you, was there anything missing in the deal?
Well, we obviously, collectively as premiers, we ask for it to be a little bit more significant in terms of, the $28 billion represents a 35% threshold of what the federal government pays for the delivery of health care. We didn't want to get in yesterday to talk about tax points and all of these percentages. So, obviously we could have had a little bit more, but quite honestly, the shared priorities that we talk about, mental health, long-term care, primary care, those are things that are priorities in PEI. Those are issues that we've been developing and working and improving, and so we'll just use that money to continue down that path.
And then how was your meeting just now with the Prime Minister? Did you bring up anything new, or would you raise, or any concerns?
Well, we talked a lot about healthcare at the beginning, of course, because it's so fresh and it's what everybody wants to talk about. You know, we also talked about, from a P.E.I. perspective, our next interest is the infrastructure, the federal infrastructure programmings are coming to an end in this fiscal year. We want to know what's coming next, what flexibility will come in those pots of money. We talked a lot about climate adaptation. I presented him the P.E.I. plan, our climate adaptation plan. We've asked the federal government for a 10-year plan to help us get P.E.I. ready for the changing climate. Things like burying cable or power lines, shoreline protection, all of the things that were really exposed during Hurricane Fiona and P.E.I. in September. So that was a big priority for us. And, you know, we talked about bridge tolls as well. I know that might not be a big issue for the press gallery in Ottawa, but in Prince Edward Island, we're trying to start a working group with the federal government to reduce tolls to $20 at the Confederation Bridge and Northumberland Ferry Service. And the Prime Minister seemed to indicate today that we will move ahead with that working group, and I'm excited to hear that and hoping for good news in the future.
Anything left out of those bilateral deals?
You're saying that there's priorities you had, but what's been offered by the federal government? Is there a bilateral, you know, opportunity for the federal government to support something that would enhance or improve healthcare that you think wasn't put on the table?
No, I say that the priorities that they laid out, the 5 of them in particular, are really, they're the 5 priorities, I think, across the board, but certainly for P.E.I., we've made a lot of improvements in the delivery of primary care in P.E.I. By the end of March this year, we will have 14 patient medical homes, we call them, which is a collaborative model of delivery. So you have, you might have 1 or 2 family doctors, you might have you know, an RN, an LPN, a registered care worker, a social worker, a nurse practitioner, and that's a collaborative center where an individual from P.E.I. will walk in, and maybe normally in the past they would have seen a doctor first, but they will see some other professionals before, maybe don't even need to see the doctor. So that's one of the innovations that we've been working on. We've also talked about, been delivering what we call our Pharmacy Plus program. So pharmacists in Prince Edward Island, we've given them the ability to prescribe 32 common ailments. And that so far that we, I think it was October or when we got that started, each week it keeps about 1,200 people out of the ER. It takes them out of the need for a family doc. In P.E.I., you used to have to go to the emergency room to get your prescription filled, and so we've changed that. So these are some of the innovations that we've been working on, and that money from the federal government will help us get there a little bit faster and will help us bring more innovations.
So these are essentially already programs that were existing within P.E.I.?
Well, many of them. I mean, healthcare across the board. I mean, if you're in British Columbia or Prince Edward Island, the issues we face in healthcare are pretty much the same. We don't have a whole lot of, we don't have enough family doctors. We don't have enough nurses. Health human resources are challenging. We're trying to do the best we can with what we have, and so that's where these innovations come. So to me, it hits the mark for what we need. Could we use more money? Absolutely. Will I ask them for more money in the future? Absolutely. I think this is a good start for us, and I'm ready to put it to work.
Have you been told that yesterday's offer from the government was a final offer, or was there any indication that there could be wiggle room for more money?
Yeah, I mean, I guess I said this when I did my interview with back home with CBC, and essentially, he who has the gold makes the rules. So I don't know if this is a negotiation. I think we had put forward what we thought was a fair deal. I think the federal government has come back. At the end of the day, the federal government are the ones who say, this is the federal money, this is what you have. So I'm prepared to take that money and put it to good use. But as I say, I don't think it ends here. I think we need to continue to look for more opportunities to partner with the federal government when it comes to the delivery of health care. And I suspect that other jurisdictions may want to try to do some other things, and that's what's going to serve them well, but what serves P.E.I. well is me.
Division here, because you're saying, hey, like the federal government decides on that money, and
well, I bet no premier's going to send the money back. I promise you that.
Premier Doug Ford said, call it the starting point.
Yeah.
You know, I'm not sure that the Western premiers are in the prairies are quite as content with this offer either. So, you know, but it does seem that some of the you know, older demographic Atlantic provinces are seemingly more positive when they talk about it. You included. So. Well,
I mean, I think partially maybe that is because we have worked hard with the federal government to have them recognize the needs we have. And I think that's why the bilateral process is so important to a small jurisdiction like us. So that, to me, that's a huge win for Prince Edward Island. It's a huge win for smaller jurisdictions that we were able to get recognition for. It's not just a straight per capita fund. And so that, to me, probably we're excited about that. And I think that's important for us. But I mean, you know, Premier Moe can speak for himself, and Premier Smith can speak for herself when it comes to what their needs and wants are for their own provinces. But as I say, I don't think any premier is going to send the money back.
Have you heard from any of your counterparts that they're not going to take the deal?
As I say, my suggestion and belief, I've been around this for a long time. I used to work with Premier Binns, and we were having these negotiations in the late 90s and early 2000s, and you know, I don't think anyone will send the money back. Do they want more? Yes. Will there be negotiations? Absolutely. But I think that you know, the federal government put a significant amount of money on the table, and I think it's I think it will be accepted by all the premiers eventually.
Will any premiers break ranks?
I don't even know what that means. You know, in terms of, you know, I think overall, I'm not sure the Prime Minister and the federal government is obligated to negotiate with 13 premiers as a group. I think we've leveraged the Council of the Federation table to do some good things in that regard, and I think the Prime Minister recognizes that. But at the end of the day, I think, you know, my job is to try to get the best deal I can for Prince Edward Island. As I say, there's $57 million, 46 or 48 of which we didn't know was coming to P.E.I. That's a big amount of money for us. So I'm excited to get that money and put it into good use. But we'll have a lot of other, you know, responsibilities and requests down the road that we'll need to get at.
So would you'd be willing to sign the deal? I mean, I'm not saying that you are right now, because you're not saying that I'm, unless you are, and you could tell us. But listen, without the other premiers, you would say, hey, I'll go alone because we like it for P.E.I.
I don't think there's no deal for 13 premiers. There's no piece of paper to sign. As I say, as a Council of the Federation, we've tried to lobby as a group to get the federal government to recognize why they need to spend more money and to have a bigger chunk of the healthcare spend. At the end of the day, I'm elected by the people of P.E.I. to do the best for P.E.I., and that's what I'm going to do. It would be irresponsible for me to send $50 million back or to say we don't want that. I can take the money and say let's put it to use. I can come back to Ottawa in a few weeks' time and say, well, this is what we need or whatever, and to keep those negotiations going, and that's what we'll do. So.
Has there been any indication from the federal government that this is a take it or leave it type situation, where if you don't take this offer, they're just going to pull all the funding altogether?
No, and I don't think it's the intent of the federal government. I can't speak for the Prime Minister or the Minister of Health, but I think they are responsible to deliver the Canada Health Transfer, and they're doing it in this such a way. Whether or not everybody likes that or agrees with it, I don't think really matters at the end of the day. I think it'll be what it will be, and the premiers will be obligated to take this money. Now, whether they want to participate in the bilat discussions, I think that'll be an individual provincial decision. We good? Okay. Thank you. Thanks, everybody.